Underneath everything we think of as modern medicine, there's this quiet revolution going on. And it's not about new drugs or fancy robots. It's about language. A digital language that our health data speaks. And learning to understand it, well, that's unlocking the entire future of healthcare.
I mean, just think about it for a second. What if your doctor runs some tests, then you go see a specialist across town, but their computer can't read the results from your doctor's office? It's like they're literally speaking two different languages. How could they possibly give you the best care? Pretty scary thought, right?
Well, for decades, that wasn't a thought experiment. It was the reality. A digital Tower of Babel, where every hospital, every clinic, every single device spoke its own unique language. And this wasn't just an inconvenience. It was genuinely dangerous. Critical information was getting lost in translation, putting patient safety at risk.
But here's the good news. Behind the scenes, that quiet revolution I mentioned has been gaining steam. It's not about some new miracle cure, but something way more fundamental, creating a universal language for all health data, built on a whole new set of digital rules.
So how did we even start to tackle this massive problem? Well, it began with a really important first step, the first real attempt to create a kind of universal translator for medicine. And that standard was known as HL7.
So, HL7, which stands for Health Level 7, was that first major effort. Think of it like the very first dictionary and grammar book for health data. It gave all these different computer systems a shared set of rules so they could finally start to communicate.
And honestly, it was a breakthrough. For the very first time, a hospital's admission system could actually talk to its billing system. But it was a pretty basic conversation, kind of like trying to get by in a foreign country with just a phrase book. It was clunky, super rigid, and a long, long way from being fluent.
To get to that real fluency, healthcare needed a serious upgrade for the internet age. It needed a modern dialect, one that was faster, way more flexible, and a lot more powerful. And that upgrade? It's called FHIR.
FHIR stands for Fast Healthcare Interoperability Resources. And the secret to its power is that it's built using the exact same technology as the modern internet, the stuff you use every day. It uses something called REST APIs, which are basically universal adapters that let different apps and websites share information super easily. It's the whole reason your food delivery app can show you a map from Google Maps.
Okay, so here's the key difference, right? If the old HL7 was like a thick, complicated, and really rigid instruction manual, then FHIR is like a flexible, modern toolkit. It's built for today's world, which makes it so much faster and easier for developers to build amazing new apps for healthcare.
Probably the best way to think about it is your weather app. You don't need to know anything about meteorology. The app just seamlessly pulls the data it needs from a satellite and shows you the forecast. FHIR brings that exact same simplicity to healthcare. A doctor's app on an iPad can now securely and instantly pull up a patient's records from the hospital's main system. It is a total game changer. So, what does all this new fluency actually mean in the real world? This is where that quiet revolution starts to get really loud, and the impact, it's just massive. This quote right here really says it all. We're not just talking about making things easier inside a single hospital. This new language connects the entire healthcare ecosystem, all the way from a patient's bedside to the highest levels of government.
Let's look at a huge example, developing new medicines. First, data is collected cleanly and consistently right there in the hospital. Second, that high-quality data can be shared seamlessly with researchers who are running clinical trials. Third, pharmaceutical companies can analyze all that data faster than ever. And finally, the whole process is streamlined, leading to faster drug approvals. What you get is a global conversation. Researchers get much better data to work with. Pharma companies get faster insights. And regulators, like the FDA in the US or the EMA in Europe, can review submissions way more efficiently. And the ultimate result of all this? Life-saving drugs get to the patients who desperately need them faster. So, the old barriers are finally coming down, and this new common language is taking their place. So what comes next? It's really incredible when you step back and look at it. We've gone from a world of isolated data silos, a world of data silence, to a truly connected healthcare ecosystem. For the first time, our health information can speak a universal language, and that just opens up unbelievable possibilities for things like personalized medicine and groundbreaking research. But this newfound fluency, this incredible power, brings up a really crucial question. Now that our health data can speak this universal language, who gets to decide the rules of the conversation? How do we make sure this power is used safely, ethically, and for the benefit of everyone? That is the next great challenge we all have to face.